Xeroderma pigmentosum, also called XP, is a rare autosomal recessive gene disorder which impairs the body's ability to repair DNA damage induced by UV radiation. An autosomal recessive gene disorder means that this disease develops when two copies of an abnormal gene are present. For a child to develop XP, they must get the XP gene from both their mom and dad. If a child gets a normal gene from the father and XP gene from the mother, then the child would be a carrier for the disease, but not actively living with the disease.
DNA is damaged by different factors, such as toxic chemicals and UV radiation. In a healthy person, DNA damage can be repaired by mechanisms such as the nucleotide excision repair, in which damaged parts of DNA are removed. However, in a person with XP, this repair action does not take place due to the inherent deficiency in a UV-specific enzyme called excision endonuclease. With the deficiency in this enzyme, individuals living with XP are limited to various exposures, especially sunlight. Though essential for survival for majority, the sun becomes the most harmful and life-threatening factor to those living with XP. Sunlight damages DNA which cannot be repaired, resulting in uncontrolled cell growth and division. This places individuals living with XP at high risk of developing skin cancers, even with minimal sun exposure. Individuals living with XP may also experience freckling of the skin, severe sunburns, extremely dry skin, rough surface skin growths, and abnormal dark spots. Eye changes may also occur, such as severe sensitivity to sunlight, inflammation or cloudiness of the cornea, and turning out of the edge of the eyelid. Neurological symptoms may be seen, though the cause is unclear.
Though rare, XP is more prevalent in Japan compared to other countries. XP usually presents itself at age of 1 to 2 years with unusually severe sunburns from minimal sun exposure. However, it's often diagnosed later after severe symptoms and can be confirmed by genetic testing. If unprotected from UV radiations, skin cancer may develop between 3 to 10 years of diagnosis. Individuals living with XP can have a normal life expectancy as long as protection and preventative measures are in place. People with XP may feel isolated since most of their time is spent indoors.
There's currently no cure for XP, but there are drugs available that have been effective at preventing new skin cancers. In many patients, taking retinoic acid resulted in significant reduction in the frequency of new skin cancers, perhaps because retinoic acid has a role in regulating skin cell development and cell death. However, the drug is associated with severe side effects. Another drug, imiquimod, can be applied as a cream and is effective in treating superficial cancerous lesions, perhaps because of its immune response enhancing properties. Minimal side effects makes it a good alternative treatment for skin cancers that are not suitable for surgical removal. Unfortunately, both these drugs must be continued indefinitely, and discontinuation can lead to reoccurrence of cancerous cells. Currently, gene therapy to correct the mutated genes responsible for XP is being researched as a future cure.
Steps can be taken to decrease risks associated with XP. The main goal of treatment is protection from UV radiation. Avoid sunlight exposure by staying indoors during the day, limiting outdoor activities to nighttime. Consistent UV radiation protection when exposed to sunlight or UV emitting bulbs is important. Visit your doctor for frequent examinations. Avoid smoking. XP patients who smoke are at an increased risk of developing lung cancer compared to the general population. It is important for XP patients to take vitamin D supplements since they are not getting vitamin D from the sun.